who's maybe lost their job and somebody who's streetwise or something along those lines. And there certainly are that situation. But the truth of the matter is that prescription drug abuse is everywhere. I mean, it's found in professions, and it's found in schools, and it's found in the military, it's found with our pilots and our physicians and our pharmacists. I mean, it really, there is, in that regard, it's an equal opportunity to destroy it.
So that's when you say it's a problem both inside and outside. You mean general public, but you also mean people who are providers.
Yeah, and that's one of the things that we see at the Board of Pharmacy, and Peggy, as a compliance officer, does investigation. So there's certainly prescription drug abuse is found in the general population, but it's also found within our own profession, just in medicine or nursing or whatever. And you might imagine that for a pharmacist it could be challenging. You imagine if they had fallen off of a roof and they've broken their back, and then for 2 or 3 months they've been in excruciating pain, and the doctor treats them with pain medication. And then finally the doctor says, you know what, you've been on this for a long time, this is a good time to stop now. But they go to work and their back bothers them, and maybe they're not sleeping right, and it's a long day and it's stressful, and they say, gee, you know what I need. I've had them before, they're right there on the shelf. And so that's been a problem where they've been exposed to drugs for a long period of time from an injury. They don't mean to start life down that path.
Makes a whole lot of sense. Bruce, did you want to add something?
Sure. We meet the third Wednesday on the Board of Pharmacy every month. And I've been on the board 9 years. This is my last year. What we're seeing lately, it's increased every month in report of investigation, certainly between pharmacists, technicians, and every month is more and more, and it's compiling. It means that it's not only localized in the schools or homes, it's in our profession. So it's just unbelievable the reports we see on a monthly basis. So I'm going to say this: addiction doesn't know race, addiction doesn't know race, doesn't know wealth, doesn't know young adults. It just engulfs you, and I have the experience of seeing that firsthand. The end is very devastating. The end is death. So we'll tell about it later on. So just when you deal with drugs, education and community awareness is #1. If you don't deal with the problem when you see it and you say, well, it's not my problem, not my kid, that will grow up and the end is not good. Thank you.
Thank you. Anybody on this side? The topic is this just a particular slice of the population, or is it really something that in your own work with kids, Scott, maybe you have something to say?
I'd have to say, I was an inner city kid in Nashua. I had friends, multiple friends that I played sports with, and drugs, like Marish said, it doesn't discriminate against anybody. It doesn't care what kind of goals that you have or what you aspire to be or where you are already. Drugs can creep up on you. Prescription drugs can creep up on you very quickly. It produces a feeling that's an escape, especially from the pressures of this world. And I know I felt in a society to thrive, and I found my escape in prescription drugs, and I thought I could hold it together when the drugs were really controlling me. And to say that drugs discriminates or that it's a particular group of people just wouldn't make any sense, because I've seen really successful people doing drugs, and I've seen the lowest of lows in the inner city, and at any point anyone can fall into the trap of addiction.
I know a little later in the program you're going to have a chance to talk when you block time, but I'll just ask you simply, how are you doing here?
I feel great. I've never felt better than I have in my entire life. I never thought that I'd be in a panel like this talking about drugs, talking about discrimination.
You lock up doors, you can't get out.
Yeah, right. But the organization that I went to, Teen Challenge, is a Christian-based rehabilitation center, and I found love there that I've never felt in my life, and that filled a gap in my life that today I can stand here by God's grace and share about drugs and share about where I've came from and what I've seen. I've seen some horrific things in drug addiction, and I'd be willing to speak about it. Prescription drugs is what really led to it, but I was involved with heroin and crack
Great. It's good to have you. Any other comments from this side?
Yeah, if you don't mind. I just wanted to say that, I don't know if folks can hear me. I'm told I actually do not need a microphone. So. One of the things that we've noticed in treating substance abuse or addiction is that we're seeing a bigger trend as folks are calling who are currently on prescription medications and are currently abusing them or addicted, where the doctors, of course, are telling them that's it. You know, you're going to have to start weaning down. And historically, we've dealt a lot with alcohol and opiate abuse of a different kind. And now, of course, folks are calling in so that they could actually detox and actually stay at the prescription that they're supposed to be in. And I would say within the last year, the numbers have actually increased. So we're seeing a very high number of folks who need to detox from their prescription medication and still on the prescription medication. So it's very new for treatment.
Yeah, I was surprised by the Chloracidin HBP, which, you know, I started to take. I don't know, get into this.
Do you want to tell us anything?
Just that it didn't work, at least for what I was taking. I didn't realize that it had the potential that it did. I'm glad I saw that up on the screen. Okay. Let's move off of any other misconceptions or things that you believe people might think that are myths or misconceptions about on this whole subject that we may not have touched on important things. Okay. Speak up later on if that's something that comes to mind. Rita, I want to get back to you, and I'd like to hear a little bit more from your perspective on. I know you've got a lot to say on this, which is great, and but how these drugs, the kind that we're talking about, negatively impact lives. And we've heard some, but there may be some things that you want to fill in.
People become so obsessed with narcotics, illegal drugs, that they will do anything to get them. They lie, they cheat, they will have any opportunity to do that. The kids, they lose interest in school, sports, they lose interest in their family and friends, at least friends that will do drugs. Adult too is involved in this. They lose interest in work, and there is a loss of productivity, which can cause them to lose their jobs. Families are distraught too. They hurt, and they're fearful, angry. They don't function normally anymore. So there is a lot of issues with that.
Yeah. Thank you. Anyone else? I'm going to switch over and start on this side. We're going to go back and forth for a little bit. Casey, can you talk a little bit about the preventative programs that you have at the high school to address this problem? Just give us a
I'll give you a laundry list.
Laundry list is good.
Thanks. About, I think it was last spring that we were asked by the Administrative Central Office to make sure that we look more in depth at this issue and how it's impacting the students of the school. And we have put together a sort of prevention panel where we're bringing together, and we've had our first meeting in September, with the community members, with students, with administration, with the resource officer, with outside agencies who are experts in the field. And I think we have Bob Thompson down here from the middle school that is joining us so that we can take a look at prevention programs in the school district. And I think we all know that sometimes the high school, I think you probably would agree, is a late start in some prevention programs. So in collaboration with the middle school, we're hoping to be able to do sort of a more thorough prevention program. So that's one of the things that we're doing. We hosted a student leadership program over the summer, sponsored by CAST, where a group of students from the region and many from Hollis and Brookline participated in our role models and leaders to sort of pioneer this program in the school. We also are members of CAST, Kathy Cray and I, and we are attending those programs to learn more and to get our statistics correct and to sort of hear from everyone about what kinds of programs are the most effective. It's one thing to offer programs, it's another thing to make sure that the students are able to hear and absorb the information and do something with it. So we look at the effectiveness of our programs. We bring in outside speakers every year. We brought in Jeremiah Johnston twice. He is currently released from the state prison, but he was a young man with a lot of potential, a great job and career, and he spoke to our students twice about an incident that happened driving drunk, and I think it was an effective presentation for our students, and we will be bringing in a woman called Dorothy Hughes this spring prior to our prom to talk. She lost her son, daughter and boyfriend in a car accident in Massachusetts, and we have actually gone down to North Andover and listened to her. Her story was powerful and effective, and we'll be bringing her in. We hope to have the mock crash in the spring, but
I'm sorry, you have what?
it's a mock crash.
A mock crash?
Yeah, which is a very...
Tell us quickly what that means.
Well, actually, I'm going to let...
Yeah, I'm going to pass it along.
A mock crash is, just as it sounds, a mock crash of either a DWI accident or drug-induced accident, where it's kind of a play, if you will, of what happens at the scene of an accident.
So you're talking about a physical crash?
Yes.
Like a
Yes,
crash
physical car crash.
Okay.
And
to the school.
And what are the points that are brought out of that situation in a mock crash?
what happens, it's not a pretty sight. The effects that it has on people driving by, people getting called to the scene from being text messages.
So to give people a very realistic
Yes.
scene of what it's all about.
That's correct.
Okay. Kathy, did you have anything to add to?
Well, I
or
think...
Casey, you're not...
No, go ahead, continue. No, go ahead.
I think one of the points that was mentioned earlier was the New Hampshire Behavioral Risk Assessment, and we participate in that every year, but we do it in a limited forum, and we don't have pull-out information for this community that stands alone. And we have participated with the National Tobacco last spring, so we have some money to actually put towards having every student be able to participate in that. And we would be able to give to the community, the school board, the staff, and students some accurate data about, you know, what is the problem as it exists in this community in Hollis and Brookline and in the schools. So we're hoping to proceed with that this year. We have a very strong school policy about dispensing medication, so that we send a message at every level that this is not something we carry on you, that has to be prescribed by doctors and limited, etc. We have our student assistance counselor who does individual and small groups for prevention with our students in the school.
You've got a lot going on as this goes on.
This is a big issue, and I think it's, you know, we spent a great deal of time dealing with academic and career, but the safety issues of our students are just as paramount as any other issue, and we want to make sure we can address those sort of globally, many-fingered approach.
I wanted to find out whether anybody on this side of the stage is involved with these programs going on at either Hollis, Brookline, or other schools in the area. Any coordination or no fight?
Well, at the Massachusetts College of Pharmacy, the students and I have been involved with the CATS organization, that's Community Alliance for Teen Safety. So not with the schools per se, but we've been working with them. And the students actually put together these case scenarios, 2 that were kind of depicting like adult scenarios, 2 that were kind of youth scenarios. And they're actually going to put these into an e-learning program that's going to be piloted in the Derry Middle School, so that students will be able to kind of go through these case scenarios. And the interactive part is they're given, you know, an option, or they're given a decision that they have to make, you know, whether to take the medication, whether to go to the farm party, whether to, you know, to tell an adult about something that's going on. And then the feedback comes back and telling them why the answer is right and the answer is wrong. So, you know, we're looking forward to getting that, you know, taken care of, and, you know, hopefully that'll get launched soon. But that's kind of a little bit of, you know, the involvement that we've had so far at the school.
Yeah. Okay. Casey, anything else that we need to catch up? I just want to take get that. I was
Well,
thinking,
I don't want to go on and on. We do have some prevention. We have the President Coalition in the school. We have Interact, and we have a health curriculum. So we try to address it at many different levels in the school.
anything else to add? Okay, Peggy, I want to get to you down towards the end there in the Board of Pharmacy Compliance Division. Is that right?
Yes.
Can you talk a little bit about your perspectives on things, what you see when you look out into this world of prescription drugs?
Mm-hmm. Well, the first thing I'd like to say is that, these prescriptions that we're talking about, they have a very valuable purpose. When I became a pharmacist 23 years ago, OxyContin wasn't out there. And people that had cancer were suffering in a lot of pain. So these are great drugs when they're used for legitimate purposes and when they're used as prescribed. But they do have a high potential for abuse. And so it makes them somewhat dangerous to use. One of the things that the Board of Pharmacy has been hoping to get is a prescription monitoring program. And it was hard to get that passed in New Hampshire. I think because a lot of people saw it as a tool to punish people. But it's really a clinical tool. And I'm very excited about getting a PMP online because it'll be useful for doctors when new patients are coming in, that they can do a quick query and see, is this really a legitimate patient in legitimate pain, and can I help them? Because we've had this balance where for a long time, physicians were afraid to prescribe narcotics, and people suffered. And then there was a push that when people are in pain, you need to treat their pain. And we kind of over-treated the pain, or allowed physicians to be duped, pharmacists to be duped by people that are just seeking narcotics. So to have this clinical tool where somebody can evaluate, all right, this is a legitimate patient, they have a legitimate need, they're not all over the state trying to get narcotics, is going to be a fabulous thing.
So this is, you'll find out a little bit, or we'll find out a little bit more towards the end of this discussion about this terribly important initiative,
Right.
the PMP.
So,
helps to fill the cracks and keep people from escaping through the cracks in the system.
and on the compliance side, we, myself and the other compliance officer, we try to educate pharmacists on red flags to look for, what things might be suspicious. There are a lot of fake prescriptions out there, along with newer and better technology. It's a lot easier to fake or make up your own prescriptions. So we have an alert system that goes out to all the pharmacies when somebody gets caught that has been forging prescriptions. We can let all the pharmacies in the state know, watch out for this. So we're involved in that, and educating the pharmacists, and also investigating diversion. And as Harish has mentioned, we've seen a spike in emergency suspensions in the last couple of years. Both pharmacists and technicians that maybe they had a legitimate medical issue, they might have needed that medication at one time, but even people that need it, and even people that are using it as directed, if they have tendency for addiction, they can get addicted, and so they use it for a few months. They're medically cleared, they go back to work, and now they're working a long shift, they're in pain, it's right there on the shelf, and I'll just take one, nobody will know, and I'll make it through the day, and then it becomes a habit, and they do it day after day after day, till somebody starts noticing, geez, we should have more than that, where is it gone? So,
Thank you for your perspective on that.
thanks.
Anything to add from this side of the house? I see people sort of moving towards the microphone.
He doesn't have
Okay, good. I work rather closely with PEG because I'm the one who's often contacted either by a pharmacist or by the Board of Pharmacy to go and investigate fake prescriptions. what we refer to as doctor shoppers, whom we hope to stop with the PMP program once it gets started. And one of the things that somebody said to me is that drug addiction makes the average person, once they're addicted, makes them do the stupidest things that they've ever done in their lives. And that's what it does. And all the things that I've seen in the 2 years that I've been in the narcotics unit, I gotta say, some pretty stupid stuff. And watching people throw away their lives and throw away their careers, you know, pharmacists losing their licenses, technicians being fired from their jobs for stealing narcotics from the pharmacies that they're working in. That's just stupid.
Thanks, Chris. Anything else? I want to start to get into a topic that I think many of you will want to be hearing about, and you probably have questions too, and I'm going to direct a question to Bill, quickly from the Brookline Police Department. What words of advice would you share with parents to try to assist them in identifying drug abuse of this kind that we're talking about with their children? Are there some things that you can kind of step into with us on that subject?
It's very easy, actually, to tell if there is abuse of some sort of a substance in a human being. I can remember back as a young state trooper working on roads 35, 36 years ago, when you arrest somebody who's impaired, you bring them in, they blow in the breathalyzer, and there's 0 zeros, and it was like, oh my God, I must have messed up. Well, we didn't know at the time that they were under the influence of something else. So through training and through identifying different types of observable signs and effects, we were able to encapsulate every single drug known to man, whether prescribed or illicit, and fit them into 7 broad categories. Each of those broad categories was developed based on what that drug does to the human body, with the observable signs and effects, clinical signs and effects, and how it causes a person to behave and act. We've taken that program and trained police officers all over the country. We've now taken it outside of the law enforcement realm. We've trained educators, administrators, we've trained athletic coaches and athletic administrators, civic organizations, private sector businesses, and what have you on the observable signs and effects. We now have programs that we actually go out and do parent forums. The things you have to look for, first of all, and to realize that addiction comes in 2 forms. There's a physical addiction to the actual drug itself, and there's an emotional addiction to the feeling that the drug gives you. And I think Scott can attest to that. Both of those have to be defeated in order for a person to become sober. Look for changes in attitude. Look for changes in behavior, first and foremost. Try to identify what types of those changes are. Do they go from a very happy-go-lucky kid to angry all the time? Do they go from a kid who's very hyper and ready to go all the time to somebody who's become very lethargic? And remember that the eyes are the windows to the soul. These drug categories, especially your opiates, especially your painkillers, will constrict the pupil so that it almost looks what some people refer to as pinhole pupils. Other drugs, some of your stimulant drugs, will make the pupil widen. They'll actually cause the pupils to dilate beyond normal. These are things that you have to look for. There are so many of these observable signs and effects out there that to try to sit here and list them all is completely impossible to do. But there are a lot of resources up here on the stage. Pharmacists, the investigators, the school personnel, and the law enforcement people, as well as from Keystone. People who deal with persons who have problems like this are very aware of what those signs and effects are. If you ever have a question, if you ever want any answers, if you have a concern, obviously in a public forum, you certainly probably don't want to speak up about personal matters, but don't hesitate to contact any of us, because there are ways to be able to detect, and then there are other resources to get you the help that you might be looking for.
Rick, I'm going to ask you to follow up a little bit on that and talk about how you do that. I mean, once you have a pretty good idea that something is going on, what kind of steps do you take with the student, say in this case, and or the family, to begin to address the issue?
Personally, as a police officer?
Well, let's start there.
Depends. Driving, are they found on the side of the road? I mean, There are steps to protect the person if they're found on the road, bring them to the hospital, give them the help they need, which is protective custody. If they're driving, generally you go through the motions if they're impaired. If they do, like in the old days, below 0-0, if they have something else on board, we call the trained DRE, drug recognition expert, to try and figure out what they are on.
In your role as resource officer,